So Hashimoto's encephalopathy, it's steroid responsive, and it is associated with seizures, cognitive decline, neuropsychiatric symptoms like paranoia, altered state of consciousness, confusion, delirium, and hallucinations. An increased amount of TPO antibodies, myoclonus, and slow wave activity on etiology as well as pathogenesis of this disease. This particular manifestation is not very well established till date. Features like hoarse voice or clumsy speech, if found in the patient, is due to fluid accumulation in tongue and the vocal cords. Treatment of Hashimoto's thyroiditis, levothyroxine is given. Initially, the dose is 50 microgram for 3 weeks, then 100 microgram for the next 3 weeks, and then a maintenance dose. Thyroid profile should be done after 6 weeks until the dose is stabilized in the patient. These are my references.
Post titration for Hashimoto's thyroiditis.
Yes, sir. Along with that, plasmapheresis and IVIG can also be.
For Hashimoto's thyroiditis, what is the reference for this post titration?
Sir, Davidson.
And they have till what dose we can go?
Maintenance doses of 100 to 150.
But there has to be some. If someone is 130 kgs, will still giving the person similar dose maintenance vis-a-vis someone who is 60 kgs. So it is around 1.5 microgram per kg body. This is ceiling dose. Till there you can. Okay. So if someone is 150, you can go till 400 micrograms. 225.
Thank you.
This is a very important topic for you. Please be attentive because your exam may one or the other way will be asked.
Good morning, everyone. Today, myself, Masu, is going to give presentation on prognosis in schizophrenia. My moderator is Dr. Sathak Bandar. Here are some basic definitions. Prognosis: prediction of the course, duration, and outcome of a disease based on pathogenesis of disease and presence of risk factor for the disease. Course of illness refers to usual trajectory the disease follows from the moment of exposure to causal agent until recovery or death. In mental disorder, where the cause of illness is not known exactly, course is described from onset of the first symptom. Outcome: state or condition of the person suffering from the illness at a definite point of time. Introduction. Historically, poor outcome has been often considered as a basic to the concept of schizophrenia. Bleuler, who coined the term schizophrenia, believed that it did not permit a full restitution ad integrum. मतलब वापस वो अपने पुराने स्टेट मतलब नॉर्मल स्टेट में नहीं जा पाता फिर से. Scenario is less bleak and pessimistic now. Klisch and Leonhardt insisted that if a patient recovers, he could not have had schizophrenia. मतलब अगर कोई पेशेंट रिकवर कर जाता तो उसको स्किज़ोफ्रेनिया था ही नहीं. Summary of the finding from the follow-up studies on source and outcome of schizophrenia. Course of the schizophrenia highly variable, both within and between patients, even after taking account of methodological heterogeneity across studies. Broad range of possible course patterns ranging from complete recovery to continuous unremitting psychopathology, cognitive performance, and social functioning. Less than half of the patients show substantial clinical improvement after follow-up time averaging 6 years. Trend in a course and outcome over the past century revealed a substantial gain in favorable outcome. Course descriptors show greater variability being in the first 5 years. Outcome estimates vary depending on the diagnostic classification used. Patients diagnosed using broadly defined schizophrenia have generally better outcome than those diagnosed using narrowly defined schizophrenia. Best estimates to the date suggest that all known prognostic factor or psychopathology explain only a small amount of total variance in outcome. Good prognostic factors are late onset, acute onset, obvious precipitating factors, good premorbid personality, presence of mood symptom, presence of positive symptom, good support like married and good family condition, stable family condition. Bad prognostic factor, young age at onset, insidious onset, no precipitating factor, poor premorbid personality, low IQ, many relapses, no remission in 3 years, poor compliance, negative symptom, poor support system, family history of schizophrenia. Here are my sources, and I will interpret this graph. In first, patient is initially normal, then there is insidious onset of disease. Then after simple course, the patient return to its original mental condition in 10% of cases. In second study, the onset is insidious and there are episodes of schizophrenia, and then the patient returned to original mental state as he or she was earlier stage. Third, acute onset, simple course, poor outcome. Patient does not return to its original state of mind. In fourth, acute onset, episodic course, and poor outcome, 5% in 5% cases. Fourth, insidious onset, simple course, poor outcome, 14% cases. In fifth case, insidious onset, episodic course, and poor outcome. Prognosis Having a diagnosis of schizophrenia is associated with a reduction of life expectancy by as much as 20%. Persons with schizophrenia have higher mortality rate from accidents and natural causes than the general population. However, the higher rate may be related to fact that the diagnosis and treatment of medical and surgical condition in schizophrenia patient can be clinical challenges, and in some cases, clinical neglect may be a factor. Reported remission rates ranges from 10 to 60%. 20 to 30% of all schizophrenia patients can lead somewhat normal lives. 20 to 30% experience moderate symptom. 40 to 60% of patients remain significantly impaired by their disorder for the entire life. Poorer than patient with mood disorder, although 20 to 25% of mood disorder patients are severely disturbed at long-term follow-up. Here are my references. Thank you.
Question. Go back to slide graph. So ये कितना percentage हुआ? Around 60%. There's 40% आ गया. देख लेना आर्टिकल नहीं होगा. But traditionally, this is a traditional article. Traditionally, they say that 30% will respond very well, 30% will not respond at all, and 30% will partially respond. So that is why rule of 1/3 came. But you can quote this article also for 15 years. They have taken. Any questions? First years? Questions? Gender and अलग है उत्तर prognostic factors. You are gender neutral. You are gender neutral. The data is neutral. So overall, schizophrenia is more common in males or females?
Females.
Right?
Female.
Same है. What are you saying? Schizophrenia is overall more common in males or females? Males. Females. Sure. Huh? कोई और opinion? Prevalence is overall same. Age specific जो आपके prevalence है, incidence the onset generally will come early in males, है ना, and later in females, but subsequently आप देखोगे post menopausal जो prevalence है या incidence है, that is more in females. So ultimately it equates. Lifetime prevalence similar है. Any comments? Question. First year the comments in the presentation. Maybe अबे colleagues को question नहीं पूछते. They don't want to take any risks. उनका नंबर आएगा तो आप पूछेंगे. हाँ, please.
In hyperthyroidism, there is diarrhea, and hyperthyroidism constipation is. Hyperthyroidism is stimulation.
आप बताओ. So आपने साइकेट्रिक इंटरफेस नहीं बताया कि idea of presenting all the medical disorders is you to touch the psychiatric sequelae for the presentation. तो idea कोई so hypothyroidism में जो psychosis मिलता है उसे क्या कहते हैं? Anyone? Myxedema madness given by I think roughly around early part of 20th century. Asher released around 16 or 17 case reports in one of the articles. तब आपके जो manufactured thyroid supplements नहीं आते थे, animal thyroid extracts आते थे. So Asher reported those 16-17 cases, very interesting cases of myxedema presenting with psychosis. Then they received animal extracts, and then they became better. And pre-post photographs also there. You can download that article. Srinivasan, download it. My point is that is a very interesting read. That point of time. And अगर आप उल्टा जाएं, तो अगर हम Hashimoto's की बात करें, thyroiditis, उसमें अगर psychosis होता है उसे क्या कहते हैं? Hashimoto psychosis. Psychosis form. Hashimoto psychosis is the only condition जहाँ आपको propranolol से ही psychosis relieve हो जाता है. Why? Propranolol. Why propranolol helps in hyperthyroidism? कम करेगा. Any other reason? जो sympathetic surge है उसे वो कम करेगा. That is fine. Any other reason? Very good. So peripheral conversion of जो एक्चुअली में टिश्यूज को मिलता है, क्या मिलता है? T3. So T4 से जो T3 कन्वर्ट होता है, that is being blocked by propranolol at higher dosages. So कभी-कभी क्या होता है कि हम बहुत हाई डोज पे propranolol देते हैं, तभी एक आई थिंक डॉक्टर शैली भी एग्री करेंगे, हमें एमडी में पढ़ाया गया था कि propranolol should not be given in depression, है ना, कि it causes depression. ऐसा था नहीं. But the whole idea was that propranolol at higher doses will block conversion of T4 to T3. So it will do in your brain. तो brain में T3 मिलेगा ना, T3 नहीं मिलेगा तो T3 is also implicated as a cofactor in generation of your serotonin, norepinephrine, epinephrine. वो नहीं बनेगा तो आपके बायोकेमिकल मैसेंजर सिस्टम्स नहीं बनेंगे, तो आपके डिप्रेशन के चांसेस बढ़ जाएंगे. But then subsequently it was found that currently that is not the case. That is, these are two interesting aspects. ठीक है. बट अगर आपके पास Hashimoto psychosis पेशेंट आता है, हाई डोज प्रोप्रानोल देंगे, पेशेंट ऑफ साइकोसिस भी ठीक हो जाता है. आपको एंटीसाइकोटिक बहुत सारा देने का जरूरत नहीं है. हाँ, अब आप पे आते हैं. तो जेंडर कौन सा है? पुअर प्रोग्नोस्टिक, गुड प्रोग्नोस्टिक, जेंडर न्यूट्रल है, जेंडर न्यूट्रल, दोनों में सेम प्रोग्नोसिस. यंग मेल्स, सो मेल जेंडर अर्ली ऑनसेट है, दैट प्रोग्नोस्टिक. देखो प्रोग्नोसिस का टेबल दिखा है. इसमें कुछ फैमिली हिस्ट्री डाले हो. हाँ, तो इवन फैमिली हिस्ट्री ऑफ मूड डिसऑर्डर्स becomes a good prognostic. Presence of mood symptoms, even depression or mania, दोनों. And अगर आप देखेंगे तो recently neuromagic cortical atrophy है, तो भी वो then those are also correlated with poor prognosis. This is a must read. Very important. ये आपको याद होना चाहिए. Any other questions? So asking questions is important. Why? Not from us, from the students. Why? ये important क्यों होता है कि वो क्वेश्चन पूछे? क्यों important होता है? काम कुछ नहीं.
two-way communication हो जाता है.
Interaction और
जो मैंने डिलीवर किया वो सामने वाले समझ में आया या कितना है.
तो देखो एक चीज है कि ऐसा तो नहीं सबको सब आता है. So everyone must be catering some doubts, but people don't ask question. Why they don't ask question? बुरा आ जाएगा presenter को. So asking questions is also part of the training. When you are more your hypothetical thinking, deductive thinking, are you having those kind of skills? They are only seen when you ask questions. हम तो बहुत कुछ अपने आपके सीनियर्स हम जब क्वेश्चन पूछे तो जब हमारा सेमिनार होता था तो हमसे बहुत लोग पूछते. But I think we must appreciate both the speakers. They have done very well. Especially the second speaker, I would say I was very happy when he started with what is prognosis, what is course, what is outcome. This was your idea or Sarthak's idea?
Personal guide.
Sarthak, you were very good teacher. ये तो अपने इसका अपनी presentation में क्यों डाल के? Very good. I was very happy because that shows the topics in prognosis. You went to the course. And you gave us little different things. You presented the unexpected part in a brief. I mean, congratulate both the speakers. Well, illustration के लिए हम लोग हमारे जो first years में से कराते थे illustration. So we would like to felicitate the first speaker giving the presentation. She was not at all anxious. And you spoke like a professor. Huh? With the Hindi mix. That is a very good technique. So you speak Hindi in your presentation, it catches the audience. It relaxes everyone. Thank you. We'll start with the rounds. Jaldi. हाँ, last case के बाद हम case conference continue करेंगे. जल्दी करते हैं. We'll do a quick round. Discuss about the schedule. Space. ठीक है ना?
So after the case conference, we have lunch also.